Weber Pallidi bodies. The Weber Pallidi bodies are granules within the vascular endothelium. They contain von Willebrand factors, and technically they contain the ultra-large von Willebrand factor multimers, and these multimers are released into the blood vessels when there is 1. An injury, 2. An infection, 3. An inflammation. So the 3 I's cause the degranulation of the Weber Pallidi bodies, which are granules, and release ultra-large von Willebrand factors. Where again do we get these von Willebrand factors? When platelets are released and they degranulate, platelet vasculature shows that there are alpha granules within platelets. When the alpha granules degranulate, they also contain von Willebrand factors. So the 2 main sources of von Willebrand factors are within the alpha granules of platelet and also within the vascular endothelium in the Weber Pallidi bodies that release them. Now, if there is an infection or there is an injury or inflammation, a person is predisposed to clot formation. Why? Because the ultra large von Willebrand factors are heavier. They attract platelets onto themselves. So if these factors remain within the blood, it means that there is a chances of forming thrombus all over the body. This is what we call thrombotic thrombocytopenic purpura, and this occurs reasonably because there is ultra large von Willebrand factor available. Is there any natural process of taking care of this? Yes, there is a protein, an enzyme for that matter, called ADAMTS13. The ADAMTS13 is responsible for breaking down ultra large von Willebrand factors into a soluble form that makes them not clump together and attract platelets onto themselves. And if a person is deficient in ADAMTS13 gene, that leads the person predisposed to TTP. And we ask this question because von Willebrand factor stabilizes factor 8, which is the main cause of hemophilia A in its deficiency, and von Willebrand factor stabilizes factor 8, and von Willebrand factor are stored within 1 alpha granules of platelet and the Weber Pallidi granules that are found within the vascular endothelium. If there is a severe inflammation, an injury or infection that has caused degranulation of platelets and reduced platelet count, and also has caused a wearing off of the vascular endothelium by any chance, will the 2 put together to make the patient mimic a clinical appearance or a test results that makes it look like von Willebrand disease?